Um, oh, thank you for that. Okay, well, without further ado, I will hand it over to our next speaker, Dr. Jennifer Thannhauser. Dr. Thannhauser is a evaluation lead, counselor, and professor at University of Calgary. Over to you. We're very excited for this presentation.
Thanks so much, Taryn. Really happy to be here and looking forward to some of the conversation today. And so, as Taryn mentioned, I do work at the University of Calgary, and I've been a counselor for most of my career. I was also previously the associate director of counseling and student wellness services at the University of Calgary, and then a year and a half ago, I was seconded to our community mental health and well-being strategy as evaluation lead. And so within that role was really tasked with developing an evaluation framework for University of Calgary's renewed strategy and also developing the University of Calgary's inaugural post-secondary mental health and well-being research and knowledge hub. So I'm excited to be here to talk about evaluation and surveys and data, and hopefully we'll try and make this as engaging as we can talking about this topic, as I know it's a really big topic and sometimes can get a little bit dry in the details. So we'll keep it as engaging as possible. And then my goal is to save about 10 minutes for questions at the end. So feel free to add your questions to the chat as we go along. And then we'll hold a question period for about 10 minutes near the end of our time together today. So just a quick overview of kind of my goals or hopes for our conversation today. And while this session is focused on surveys and data, I really wanted to first take a step back and talk about evaluation more broadly. And I think being able to think about evaluation as a holistic kind of process and situating data and surveys within that helps us to better understand the purpose of data and surveys for the overall evaluation of a mental health strategy. So the first part of the presentation will focus on that overview of evaluation, and I must start to speak about utilization-focused evaluation specifically. And then I will go into a little bit around evaluation of campus mental health strategies and some of the things I've learned over the last year and a half as I've kind of done a deep dive into this area. And then my goal is to also share a case example of University of Calgary's Community Mental Health and Wellbeing Research and Knowledge Hub, University of Calgary's Community Mental Health and Wellbeing Strategy and the evaluation framework that we developed for the strategy. So just a quick check-in to kind of get a sense of the room, I'm going to invite you to answer a couple of questions. The first one is, how would you rate your current knowledge about evaluation? And the second question will be, what is your current comfort with engaging in evaluation? So we'll throw up a Menti here. So we'll ask you to respond to, how would you rate your current knowledge about evaluation? Some responses coming in. That's great. So I see as we're kind of in overall in the moderate zone where we have some comfort and familiarity with evaluation. Well, I recognize that there's also a broad spectrum. We can see that in the group, which is great. So I think that the goal of today should hopefully address some of the questions that you might have about evaluation and hopefully deepen your understanding around evaluation. Taryn, are you able to move to the next slide? It's not moving for me. So the last question asked about knowledge. This question is inviting you to identify your current comfort with engaging in evaluation. Okay, we have a broad range here in terms of level of comfort. Right. So again, kind of in that middle zone, but again, we have people across the spectrum. And again, so I really hope today's conversation can be helpful in terms of increasing an understanding around evaluation and the role of surveys and data within that. And through that, hopefully also increasing a sense of confidence and comfort with being able to engage in evaluation. So thank you all for your responses. Taryn, are you able to move to the next slide? Thank you. So before we do talk about surveys and data specifically, I do think it's important to back up and really have this conversation around evaluation more broadly. Because I think having a clear understanding about what you're evaluating and why you're evaluating it will help to inform the data that you collect, how data is analyzed, and what you choose to do with the data. So a broad definition of evaluation refers to the identification, clarification, and application of defensible criteria to determine the evaluation object's value in relation to those criteria. So evaluation object is essentially what is being evaluated. And so in this context, we're really talking, for example, about mental health strategies. You might also be familiar with evaluating programs or processes or policies as well. In my role as counselor and previously Associate Director of Counseling at Calgary's Student Wellness Services, I saw many examples of mental health data being misused and misrepresented. So for example, number of students accessing counseling is a common metric that counseling centers report on. However, when this information has been brought to senior administrators, I often found that it was misrepresented or misunderstood, perhaps. So one example is people sometimes use it as a representation of students' overall mental health distress. So if more students are accessing counseling, therefore more students must be depressed or must be distressed. Others also equate it to overall demand. So if more students are accessing counseling, there must be more demand. However, there can be a whole number of different factors that play into specific number of students accessing counseling, such as availability of appointments. So one of the things thinking about in terms of evaluation is really having a clear sense of purpose about what's being evaluated so that we can identify an appropriate process for evaluating it and also interpretation of the data. Taryn, thanks. When we think about evaluation, I think it's first helpful to recognize that evaluation, generally speaking, has three major activities. The first is focused on determining the standards for judging the quality and deciding on or judging the quality of standards, sorry, and whether those standards should be relative or absolute. What I mean by that, so let's say, for example, we're evaluating the perfect chocolate chip cookie. So an absolute criteria could be the number of chocolate chips per bite. And so it doesn't matter what's happening in all the other cookies. If we say three chocolate chip cookies or 3 chocolate chips per bite would be a standard or that we would be looking for, that would be considered an absolute criteria. Or we can also identify relative criteria. And so relative is in comparison to other people within a group. And so in the context of the chocolate chip cookie, it could be the degree of chewiness compared to other cookies. And so then it's more the sense of comparison between. And so part of the decision is identifying again the standards that we are using to evaluate whatever the object is. The second core activity is collecting relevant information. And then the third is being able to apply the standards that we identified in step one to determine the value, quality, utility, effectiveness, or significance of the data that we're collecting, okay? And then evaluation always has specific outcomes it's trying to achieve. And so two key outcomes, the first is being able to come up with recommendations to optimize the evaluation object in relation to its intended purposes. And second, helping key stakeholders. So again, in the context of post-secondary, that might be funders, it could be administration, right? To determine whether the evaluation object is worthy of adopting, continuing, expanding, and things like that. So evaluation is intended for a specific purpose to give information to direct how we continue to use what it is that's being evaluated. So I'd like to focus in a little bit deeper on a specific framework for evaluation called the utilization-focused evaluation. So utilization-focused evaluation is essentially an overarching theory for evaluation, whereby evaluations should be judged based on their utility and actual use. So it's essentially a decision-making framework for designing and implementing evaluation to fit a particular situation and meeting the information needs of the primary intended users. And so essentially it's evaluation for a specific use by a specific user, okay? And so it's data with a purpose. Evaluation decisions that will need to be made in terms of moving forward with the utilization-focused evaluation focus on four key questions. The first one is, what is the overall purpose of the evaluation? So I think about this as starting with the end in mind. What is it that we are trying to accomplish through the evaluation process? Second is, what is the evaluand or the object or the focus of the evaluation? Third, what type of evaluation will be used? And there are over 80 types of evaluation, and it's really trying to be intentional about identifying that match between the type of evaluation and the purpose of the evaluation. And finally, what kind of methodology will be used to gather the data to meet those needs? So the first question asked us to define the overarching purpose of the evaluation that we are engaging in. In his book, Utilization Focused Evaluation, Michael Quinn Patton identified 80 different types of evaluation options. And so these are just 5 sample options for guiding evaluation. And I think in the academic or education context, we often understand or are exposed to things like summative informative evaluation, because that's often used within the classroom. When choosing among the evaluation options, there are several things an evaluator should keep in mind. And so first of all, purpose really determines and drives use. So for example, I was consulting yesterday with our health promotion team at University of Calgary, and they've just developed a survey for evaluating some of the harm reduction training that they do. And they wanted me to review the questions in the survey that they had developed. But before I could do that, I actually followed up with them and needed to clarify what is the purpose of the evaluation that they are conducting, and also what is the intention of the program and what are the intended outcomes of the program that they're delivering. So again, I'm thinking about evaluation with the end in mind so that I could then be able to better evaluate or understand the questions that are being asked. Second, it's important to recognize that purpose determines the evaluation questions, design, methods, analysis, and reporting, right? And depending on who is leading the evaluation, we may actually need to negotiate with the primary intended users and be clear about the priority intended purpose of the evaluation. It's not uncommon that we have multiple purposes, but we might have one core purpose, and we want to really be able to focus in on that and how we engage our evaluation. One of the important considerations when working with multiple intended users is watching for and managing conflicts and tensions between different purposes. So again, as an example from the work that I've been engaged in at the University of Calgary, I have noticed a conflict at times between the intentions of the student services team and the intention of senior administrators. And so student services team are often focused on kind of what is the process and being able to refine programming and initiatives to best meet their goals, and also what is the intended outcome. And so they're looking at interested in impact as well. And I often notice administrators are interested in rankings and being able to compare between institutions. And sometimes those priorities can conflict. And so we want to be able to work and negotiate with those priorities. For the purpose of our conversation today, I do want to zoom in on the developmental evaluation, which I've circled here. And so developmental evaluation is really specifically focused on innovation development and is commonly used by social innovators and change agents to illuminate and adapt innovative strategies and decisions for the purpose of social change, which really I think underlies what we do with campus mental health strategies. So this is utilization-focused evaluation with a developmental purpose, okay? And this approach to evaluation really does align with the goal of the mental health strategies to create thriving, caring communities. Developmental evaluators track, document, and help to interpret the nature and implications of innovations and adaptations as they unfold. So it's kind of real-time data. And they're doing this both for the processes of the initiatives that are in play and the outcomes of the innovation. And the goal here is also to help extract lessons and insights to inform the ongoing adaptive innovation process. So that's part of that sense of development, right? And so we're gathering data as it happens and revising and implementing as we go along. So along with the purpose of evaluation, we also need to identify the specific focus of evaluation. This is also known as the evaluand or the object of evaluation. And so I've included here on this slide just a few samples of potential evaluands or focuses of evaluation. There are certainly many more than what is listed here. So the evaluation focus can be defined by the target of evaluation, such as a program or a project, but also by the specific type of evaluation. So for example, process evaluation is interested in understanding the process of a project or an initiative. And so then the target or the focus of evaluation is the process, right? Same with impact evaluation. Impact evaluation is specifically focused on the outcomes of evaluation and the outcomes of a particular program or initiative. And so then the focus of evaluation is impact. So we want to be able to be clear on what it is specifically we are evaluating. And so with a strategy, we might choose to focus on the strategy as a whole to be the focus of our evaluation. But regardless of the object or focus of evaluation, it's important to still be utilization focused. So remembering that it's the intended use by the intended user. Oh, I see a question. The second one, Karen, can you clarify the second one of which?
Sorry, you were saying about the different focuses, program, project, and whatnot, and then I got the other one of the impact or outcomes, but I missed the one in the middle.
So I have program, process, impact, could be strategy. So any of these ones here, but also the different types of evaluation. So in the next slide, we'll get into different types of evaluation. And those different types can also become the focus for the evaluation. So why don't we wait and see if the next slide helps to answer that? Does that work? So the third question that we were asking in terms of developing developmental evaluation is really, again, that type of evaluation that we're engaging in. So when selecting types or a type or types, so sometimes we do multiple types of evaluation, focus on the most important concerns, issues, and questions of the intended user. And so any of these types could become a focus as well for the evaluation. We want to ensure when making decisions around types of evaluation that we have adequate resources and time to do a high quality evaluation of whatever type is being conducted. So really starting with the idea of less is more, right? Because if we have this really grand idea of evaluation, but we can't actually collect all of the data to fulfill it, then it's not really meeting its purpose. And again, this type of evaluation is really focused on the intended use by the intended user. So we want to make sure we're gathering the most appropriate data. And any number of these types of evaluation really are relevant when evaluating campus mental health strategies, as long as we keep in mind, again, intended use by the intended user. So what are we wanting to be able to answer? What question is driving the evaluation that we're engaged in? So when I was meeting with the health promotion team yesterday and talking with them about what they were wanting to accomplish through evaluation of their harm reduction training program, I was able to clarify with them that they were really interested in understanding the process of the training program, what was effective, what was less effective, to inform ongoing revisions to the program. And they were also interested in impact. So what was the impact of participants from participating in the program? And so then when it came to looking at the questions that they developed in their survey, I was looking for questions that helped to answer process and impact. Okay, so really, again, thinking about what is the intended use of the evaluation that we're engaged in. Once we have a clear sense of the type of evaluation we want to engage in, then we can look at specific methodology. And again, this is just a couple of potential methodologies that could be used. There are many, many more than this. So this is not intended to be an exhaustive list of different types of methodologies, but to give you a sense of what methodologies could look like for gathering data. When selecting methodology, we want to be sure, again, that the primary intended user understands the underlying assumptions of these methodologies, because it'll impact the type of data that we gather and how we analyze it. So we want to understand the values that drive it, requirements also in terms of capacity and resources and skills, and do we have what's necessary to engage in this type of evaluation? So again, we want to make sure that we're engaging in effective gathering of data and analysis rather than gathering data for data's sake. So again, these are just a couple of examples, and as we move through our conversation today, I will share a little bit more specific example of what we're doing currently at the University of Calgary. So finally, as part of this overview of evaluation broadly, when we're considering evaluation, we also want to consider assessing how do we assess the quality of evaluation. And so there's four main criteria. This is, again, not intended to be exhaustive. There can be additional criteria, but these are four key criteria to consider. So we might first of all consider the accuracy of the data and the evaluation. So that's the extent to which the information obtained really accurately represents or reflects that which it is we are measuring. Second is utility, and this really applies strongly to utilization-focused evaluation. And this is the extent to which the results serve practical information needs for the intended user. So again, utilization-focused evaluation really is focused on that sense of practicality. And is this data going to be useful for a specific purpose? Third, we're interested in feasibility, and so that's the extent to which the evaluation is realistic, prudent, diplomatic, and frugal. And fourth is propriety, so the extent to which the evaluation is done legally and ethically. And these are just important aspects of engaging in effective evaluation. Overall, I think that when we collect the data that we need and will use, we want to try to avoid collecting data for data's sake and really being intentional. And so where possible, start with the data that's already being collected through typical processes, so we're not adding more work, and then being really thoughtful and intentional about any additional data that you start to collect. So before we switch over to a specific case example from University of Calgary, I want to do one more check-in. And I'm curious to hear from you. First of all, what are some of the factors that influence student mental health? And what are some of the factors that influence staff and faculty mental health? And I'll explain why in a moment. So we'll do another Menti here. It's just going to load. So what are some of the factors that influence student mental health? And so it doesn't have to be exhaustive, but what are some of the factors that come to mind for you? Finances, stress, yeah. Family, food security, yeah. Competing priorities, yeah. Workload, housing. So I'm seeing lots of systemic kind of issues. Oops. Internet use, anxiety. So again, I'm seeing various, some are more internal, some are more external, some are more individual, some are more systems focused. Okay, and how about for staff and faculty? Workload for sure. Yep. This is a very popular one. So the mental health of students, current climate, finances, accommodations, generational differences. Yeah. Taryn, are you able to scroll down on that?
Let me see. Oh,
Maybe not.
fortunately not.
Okay, that's all right. But we start to get a sense of the various factors that do influence students, staff, and faculty mental health. So one of the things I think that this really demonstrates is it recognizes that mental health in post-secondary is complex, right? And it's impacted by multiple systems and multiple factors. And this makes it really difficult to apply some more traditional approaches to evaluation, which often require really clearly defined outcomes, such as key performance indicators. And also closed systems. And so post-secondary mental health does not exist within a closed system. And within a closed system, you can control external factors in order to form more clear conclusions about the data. And because we can't do that in post-secondary and the post-secondary mental health context, it actually makes it more challenging to capture a comprehensive understanding of what is actually happening within the systems to create change in individuals' mental health. So this challenge of evaluating complex and dynamic social systems or social change has led to a relatively new approach to evaluation called principles-focused evaluation. And what I would like to do is share an example from, again, from University of Calgary and the evolution of our mental health strategy and the development of our evaluation framework. And what I'll show here is how we've taken principles-focused evaluation to really build a foundation for our evaluation framework. But first, before I get into the evaluation framework, a little bit about our renewal process. So University of Calgary first launched its mental health strategy, its campus mental health strategy in 2015. And the original strategy had 22 kind of key recommendations that focused the work of the mental health strategy. And it really was a product of its time and kind of was intended for that purpose at that time. Over the course of the 10 years when it was or the 8 years within which it was kind of in existence and in action, a lot of things changed in life, such as the COVID pandemic. And the previous strategy was not necessarily responsive to, right, and was not ready to adapt to the changing circumstances of the pandemic. So when we went through the renewal of the strategy, we spent about 2 years gathering data, partly from key units on campus, lots of consultations with different groups on campus, making sure that we were reaching students, faculty, staff, administrators, and really trying to develop a comprehensive understanding about what was working, what wasn't working, where the gaps were, what the challenges were, and also, what we wanted to keep doing. And one of the key things that's really relevant to our conversation today is making this shift away from specific recommendations to a principles-based approach to our renewed community mental health and well-being strategy. And the intention of being principles-based or values-based is really intended to allow us to be more flexible and adaptive to the changing needs of our post-secondary community. So each principle of our strategy provides a general goal for advancing well-being at the University of Calgary and is tied to one of 4 levels of influence in the nested socio-ecological model that the principles operate at. And so you can see on the slide, we have principles 1, 2, 3, and 4. And the mission of the strategy overall is to operate at the university level while collaborating with university units, faculties, departments, groups, and individuals to cultivate that more caring and supportive university culture. And so as a strategy, we're primarily focused on that outer level, focused on guiding principle 1. But then we're working with the faculties and units on the community units level, and we're working with various units to develop kind of more of the strategies around the interpersonal level, and then especially working with student services and staff wellness on the individual level. So as we link this back to evaluation, through the renewal consultation process, we learned that there really was a need for stronger ongoing evaluation framework embedded within the strategy that provides continuous measurement of progress and impact and guides the ongoing evolution of the strategy as it moves forward in the future. Therefore, we selected a developmental approach, and so that was the primary purpose of evaluation, being developmental, which again focuses on supporting innovation and adaptation in complex social contexts, which is very much post-secondary mental health. And then with this, we also then, of course, identified the evaluand. So what is the focus of evaluation? And while we could have focused on the strategy, our strategy was principles-based. And because there's an evaluation framework for principles, we selected the principles as the focus for our evaluation. And the type of the evaluation became principles-focused evaluation. In terms of our specific methodology, we are engaging in a combination of participatory methodology, mixed methods, and multi-methods. Essentially, what this means is we're working with our community partners in terms of identifying data to collect and working with them to help kind of frame some of the questions that we are evaluating. We are also using a combination of both quantitative and qualitative data. And part of the intention of that is being able to better link between some of the numbers that we collect and the actual meaning and intent behind those numbers. So being able to tell the story of people's experience related to mental health and well-being, recognizing the number of students accessing counseling within student wellness services does not actually give us the full picture. So this approach that we've developed here is aimed to help us to better understand and adapt really to the changing needs of the University of Calgary community. So just a little bit about principles-focused evaluation specifically. So again, the focus of evaluation with principles-focused evaluation are the principles themselves. The overall goal is to evaluate how principles are informing, the innovations that we're engaged in, to be able to address the complex and dynamic situation within the university. And key considerations in terms of using this approach, one is that innovation is really guided by adherence to the principles. And that's why we're interested, in having the principles as our core focus for evaluation, because living into or acting out of those principles is what's going to help drive change. The primary focus is also on adapting principles to particular challenges and changing contexts. Right. So as the world around us shifts and change, are the principles able to be adaptive to still support our overall goal of enhancing mental health and well-being within the university? And then with this evaluation approach, there's no predetermined or fixed processes and outcomes. And this has been challenging in terms of working with some other people who have more traditional understandings of evaluation, and they're wanting us to define key performance indicators. But part of the reason why we don't have those predetermined outcomes is that the principles can be interpreted in different ways by different units depending on what their needs are. And so using this approach again allows us to be more adaptive as a system overall. So just kind of capturing and summarizing what principles-focused evaluation is all about. It really is evaluation of complex systems, and it allows for, as part of its process, that iterative and dynamic process that allows us to have this continuous feedback loop into the work of the strategy. And so we can constantly be engaged in adapting and revising as we work on the efforts of the strategy. As I mentioned, the implementation of the principles can look differently depending on the context of each of the champions who are engaged in this work. And there's three guiding core questions that are really core to our evaluation. The first is focused on the meaningfulness and the quality of the principles themselves. And so that's the extent to which the community as a whole are able to make meaning out of them and use them to guide their actions. The second one is the extent to which principles are adhered to. So are people actually picking them up and using them to guide their decisions and guiding how they interact and engage with the community? Because the only way principles are going to be effective in facilitating change is if we actually engage with them. And so we want to understand the extent to which the community as a whole is engaging with the principles of the strategy. And third question is what are the results or the effectiveness of these principles? That is, to what extent do they create the change that we're aiming to create through living into these principles? So I know we're getting tight on time, so I'm not going to go into this in too much depth, but in addition to principles, within a principles-focused evaluation, it's really common to also identify specific levers for change. Levers for change are essentially specific focus areas that need to be addressed in order to create systems change. And so we went into the literature and identified, based on the literature, what are some key considerations that really facilitate change in terms of mental health in broader systems. In addition to that, we identified the conditions for change. And so this is based on water for systems change. And these are essentially pathways for creating change. And so while principles still guide the overall kind of actions of the community, they can happen through different pathways. And so we will use the pathways as a way of sorting through our data. And I'll explain that a little bit more in a minute. And of course, we also want to identify anti-levers. So essentially what gets in the way of change for the community. So this is our overall framework that we put together for the strategy. And what we're focused here on is that evaluation will occur on multiple levels using multiple methods with a focus on kind of 4 key areas. So that inner circle is looking at the effectiveness of what's called the backbone. For us, it's essentially our core mental health strategy team and the advisory committees who are really dedicated to the work of the strategy. The next circle, the middle circle, is looking at capturing how the champions contribute to the thriving University of Calgary community and the work of the strategy. So champions include student wellness services, staff wellness, specific department and faculties that have dedicated roles around mental health and well-being, student associations. And so we have an advisory committee that will make up our champions and represent those core people who are really engaged in the work of the strategy. And then the outer circle is focused on evaluating, again, the principles overall and the 3 questions that I identified on the previous slide. In addition to the evaluation that's really focused on our principles, we will continue to monitor kind of the contextual factors that are happening within our broader community and society that will influence mental health and well-being. And we will also continue to collect data about the mental health of our community more broadly. And so we, again, engage in Canadian Campus Wellbeing Strategy or Survey for students. And we also have a staff engagement survey that we will do every 2 years. And so those surveys give us a snapshot into the well-being of individuals at a specific period of time. And we want to consider that data alongside the work of the principles and seeing how they're interacting together. And so all of this data will feed in together. And our intention is to engage in annual reporting to the community broadly and also feed back into ongoing revisions of our strategy. So just some of the types of data that we will be collecting. So we'll be collecting data related to the meaningfulness of principles, which will primarily be done through focus groups. Also adherence to principles, we're looking at operational unit surveys, unit reports, and focus groups with key champions. And the impact of principles, we're looking at gathering data, again, around operational unit surveys, unit reports, focus groups with champions, and network analysis to help understand how relationships are shifting and changing. Some of the key questions that we will be asking in our survey data of our champions are listed here. So again, this has been presented as kind of a framework to help people start thinking about data with an end in mind. And so as they're developing their planning for next academic term, I've been meeting with different units and we've been talking about these questions. And so as they're doing their planning, they're also thinking about the types of questions that we will be asking them so that they can report back to us in terms of how they are using the strategy to inform their planning and the work that they're engaged in. So these are just a couple of key examples of what reporting that data could look like. And we have both a program example, so this would be a student-oriented program, and a teaching example. So in the academic context, what could that look like? And I know we're running short on time, and so I'm not going to go into a lot of detail here, but hopefully Taryn, will the slides be shared?
Yes, we will be sharing the recording.
Perfect. And so then if people want to look at that more closely in greater detail, you can do that. And so then I just have a few references, but maybe, Taryn, do we have time to open it up for a couple of questions?
100%. Ella, take it
Perfect.
away.
Yeah, thank you so much, Jennifer. Sorry you had to rush through there at the end, but thank
Okay.
you so much for all that info. And yes, we will absolutely be sharing the recording so folks can take a close look at the slides. Yeah, we have to, let's give ourselves 10 minutes for questions. So if anyone has any questions for Jennifer, you're welcome to just unmute or you can throw it in the Q&A. So I'll just leave it open there for a second.
Ella, do you want to focus the questions or do you want me to go through them?
I will, yes.
Okay, perfect.
A group today. Very, but yeah, we're just waiting for some questions. We do have a comment in the chat. Thank you. That was great.
Maybe I can ask a quick question.
Yeah.
I'm not very familiar with evaluation, but we sort of try to incorporate these in all of our programmings here at CICMH. What's some great places for somebody who's new to evaluation to go learn more about evaluation?
That's a great question. So the there is a textbook on utilization focused evaluation that provides really foundational literature. And so I think that's a good place to start. There's also a book that Michael Quinn Patton, so I think that was in the references. There we go. Yeah, so Michael Quinn Patton is kind of a leading expert in utilization focused evaluation and also the developer of principles focused evaluation. And so that's also a really great resource if you're interested in learning more about that. There's two major websites and they're totally escaping me right now. So maybe what I'll do is send you an email and we can, if there's a way to send them out to everyone. The Tamarack, there's Tamarack something. If you search Tamarack and evaluation, it will come up, but it's a key website that captures a lot of evaluation information and training.
Thank you
Thank
so
you
much.
so much.
Yeah, and I love that the plug for the evaluation toolkit for CICMH. And certainly Best Practices Network also has published some information on evaluation for post-secondary and some of the work that's being done in post-secondary.
Amazing. Okay, we have a couple of questions here in the Q&A. Can you give an example of anti-levers? Is it always funding and buy-in?
Not always. So it depends on what the context is that we're evaluating. And so if I can go back actually to that slide. Oops, I went too far. There we go. So we really went into the literature to identify anti-levers to change within a mental health systems context. And so that one of them that we found in the literature was the sense of resistance to change. And so resistance to change can be mindsets that people hold, right? Attitudes or values that they have towards mental health. And also, as I think somebody identified earlier in terms of factors to faculty and staff mental health is generational differences. So some of those underlying kind of values or belief systems that people hold can become an anti-lever to change, right? And also mental models around well-being that we hold. And so sometimes that's cultural differences, sometimes that's generational differences, and various factors that can influence the mental models in terms of what's okay, what's not okay. And I think like working with students, many students come to me in the counseling capacity, talking to me that it's not okay to talk to other people, right? And so that becomes an anti-lever to change. Also, a really significant change, I think, or anti-leaver in the post-secondary context are allocation of resources. And so I think we all know the lack of resources that many of us face, and that can certainly be, and even just who gets prioritized and how for resources. And that can become a significant barrier for change. So those are some examples of anti-levers in the post-secondary context.
Thank you so much. Okay, a couple more questions rolling in. We'll just do for 5 more minutes. Do you have any examples of when principles need to be shifted in certain contexts?
It's a great question. And so we're just in the process of kind of starting to understand how the principles that we've proposed are being interpreted and understood. I'm going to again go back to our principles here. There we go. One of the things that I'm anticipating we might learn over the next year is that people have a hard time translating principle 1 into actionable steps. So that while they understand the overall intention of guiding principle 1, it might be too broad for individuals to really be able to translate that into action. And so I'm anticipating that we might need to provide some more specifics related to how do we actually engage in guiding principle 1 in terms of really building culture change, right? And that sense of sustainability as well. And so I don't have a specific example of what that's going to look like yet, but I'm starting to anticipate just on some of the conversations we're having with people that might be a principle that just needs to be refined a little bit. What we are noticing is principle number 4 feels really clear to people, and they're able to kind of really put that one into practice. But principle 1 is a bit more broad and abstract.
Yeah, for sure. Thank you. Would you put stigma into the anti-lever category?
Certainly it could be. And so that would be an example of kind of attitudes, beliefs that can become a barrier. So yes, absolutely.
Last question I have here. Is there any tool to measure academic outcomes to cost effectiveness or cost benefit analysis?
Not that I'm aware of. I also have not specifically looked into that. I suspect, though, that it won't be one single specific measure, but you will probably have to be gathering different types of data and then being able to do some analysis to explore the relationship between academic outcomes and cost effectiveness.
Yeah. Sorry, just getting one more question here. Can Jennifer share some evaluation works? Example, how does she now do evaluation on the mental health/counseling services provided at U of C? Can she share some recent findings as well?
So in terms of what I'm currently doing, or what we're currently doing, because we just renewed the strategy, it officially launched the renewed version last year. And over the past year, I've been developing our evaluation framework as we're now building capacity within the university to engage in this evaluation. So one of the things I'm specifically doing right now is meeting with units within our student services area to work on helping them thinking about evaluation as they're engaging in program planning and implementation. And so right now they're doing a lot of planning for the coming academic year, and I'm meeting with each of the units. And so we can go forward again. Oops. This one. So I've actually been meeting with the units, talking to them about our overall evaluation framework. I've been orienting them to this set of survey questions, which we will be sending out next spring, so that they're starting to think about how do they start to think about gathering data to respond to these questions. And then I'm also working with them kind of a bit more one-on-one in terms of thinking about their specific goals for evaluation and aligning than the data that they're collecting with the outcomes that they're wanting to achieve through evaluation. And so we don't have any specific outcome data yet because we're in the early stages now of preparing people to engage in this type of evaluation. But hopefully next year we will be able to have some data to start to share.
Amazing. Thank you so much, Jennifer. Thank you so much for answering those questions and for your presentation. I'm sure we all found that really helpful to help demystify some key components of evaluation. And also, Jennifer, you have a question in the chat, but I'll let you take a look at that. And Taryn, I'll hand it over to you.
Yeah, of course. Thanks so much.